Welcome to It's Your Case, presented by VetCT. I'm Amy Zeltzman, your radiologist on demand for this case. This case's theme is vehicular trauma. We have a 2-year-old male castrated Labrador retriever who is shocking on presentation following vehicular trauma earlier today. He was initially responsive to fluids and analgesia, but has progressive abdominal effusion documented with moderate to marked abdominal pain. Initial thoracic radiographs show significant pulmonary contusions. We observe in our baseline image that there is poor distinction of the urinary bladder and reduced caudal, ventral, abdominal serosal contrast. We do have mild corrugation of the descending colon as it approaches the pelvic canal. There is mild air-filled distension of the transverse colon and region of the cecum. Let's start to take a look as we inject contrast. We don't observe the clear distinction of the urinary bladder viscus. As more contrast is injected into the urinary bladder via the urinary catheter, it's deposited haphazardly into the caudal peritoneal space and then quickly dissipates into the larger peritoneal cavity as we observe that there is increased opacification in the cranioventral abdomen. There is no increase in opacity in the region of the inguinal soft tissue opacity that is observed extra-abdominally. In the ventrodorsal view, we observe that there is mildly increased soft tissue opacity lateral to the left ileal wing. There is a paramedian complete fracture of the left pubis. For this patient, we observe that there is no clear distinction of a urinary bladder consistent with ruptured urinary bladder and associated peritoneal effusion. The peritoneal effusion is most consistent with a uroabdomen and likely hemorrhage. There is concurrent evidence of pelvic trauma. The corrugation present in the descending colon could indicate a colitis secondary to irritation from the presence of urine in the abdomen or the addition of positive contrast media due to the hyperosmolar nature of this contrast media. Other findings are included in the larger exam that will be presented as DICOM images and in the report available. The key points in this case are that the complexities of vehicular trauma warrant a global assessment of the patient. This begins with physical exam and may warrant a wider scope of imaging. Dilute iohexol can be used to confirm bladder integrity through the use of a technique called cystogram. The integrity of the urethra can be further evaluated through another component of a positive contrast study called a urethrogram. In this component, the urinary catheter is slowly withdrawn from the urethra as positive contrast is inserted. Be sure to view the full images and full report with this case. Thanks for listening, and remember, it's your case, so be sure to post your questions.